good morning, good afternoon, whenever you're watching this. I'm Anita Finley, and I'm your Zoomer Times TV host. Of course, it's run by Boomer Times and Senior Life, and we are very happy to have one of our favorite doctors, Dr. Mohsin Jaffer, who is, of course, the founder of the organization that you see that's always, he's always in the back, not the back cover, but inside back cover, Senior Medical Associates. They have many offices all over Broward County, and Dr. Jaffer is kind of a celebrity. When I want to show people what we do on Zoomer Times, I always bring his video up because he's such a personality. When you went to college and you wanted to become a doctor, had you thought about being maybe a radio producer or something, or TV?
I didn't do the media. I was so gung-ho on medicine. That was my only passion.
Right.
That passion is now reflecting on our interviews because over time you learn the skills of how to appeal to the minds of our patients. You see, because doctors are guilty of using the medicalese, and it's difficult for people to understand. So you've got to talk in simple language and in convincing language and convince them, because only a good patient is the one who is a partner with his or her doctor. And the communication skill is the most important thing to convey the message the doctor is trying to give vis-a-vis medications or some lifestyle changes. And if you as a doctor can convince the patient to not only understand and comply, then that is great success in our partnership.
You're absolutely right. That's the way it is. I think that's true in any business, though, Dr.
Sure.
Jaffer. I mean, even when I'm selling ads, I mean, I have to convince them that we're the company they want to advertise with. It's with everything, isn't it?
It is. Human communication is the greatest essence in success.
And yet there are people who are really nice people, but they don't know how to communicate. So, and I'm sure you find this with some of your patients. You want them to tell you things, but they're afraid. They don't know if they should tell you how they really feel, right? How do you get that out of them?
I think you are so right. There are so many people who have this inhibition, or they feel afraid, or they feel inhibited, or they feel trepidation in telling you all that. So what we tell them is to keep a running list with a magnet on their fridge and write down things that come to their mind. And when they come, to bring in the paper of all the questions they thought about in between the visits. Of course, if something is urgent, they call us. But if something is on their mind, to call, so that when they come, they don't forget. Also, seniors, their short-term memory can be very deficient. So they forgot what they were thinking to ask this morning. Now they're in the doctor's office in the afternoon and they say, oh, gee, what was I going to ask the doctor? This way it's written and it's there, and their visit is more meaningful, and all their potential questions have been answered.
Yeah, that's good. Very good advice. So now tell us a little bit about the whole thing of what's going on with COVID and how people, they're afraid to go to their doctors. They've changed a lot of things, some good, some bad. How are you handling this whole epidemic?
Unfortunately, the whole business of COVID has been taken out of the medical context and has become a social context, where people are giving their opinions for or against the vaccine. There is a lot of false propaganda out there against vaccines, that they are going to modify your DNA, they're going to modify your body, they're going to create a lot of havoc in your body down the road, and bad things about somebody's going to put even a chips in your body. Horrible videos out there, and I've seen most of them because my patients send them to us and say, what do you think of this? I don't think I want to take the vaccine. So it has been a very yeoman's task on our doctors and our staff's part to fervently request our patients to ignore this negative propaganda, to convince them to get the shot. And I've taken my 2 shots. You told me you took your 2 shots. So we are evidence that, look, we are practicing what we are preaching, that we have taken shots ourselves, and we want you to take it. Why? Because it's the only way to avoid a very bad fate. Because if person over 65 gets COVID, their chances of having a very sick outcome and maybe even death is very high compared to a young person.
Do you know that I still wear my mask, even though I've been fully protected and I feel fine? I still wear my mask. I still don't go out to a lot of crowded places. I don't go out to dinner. I decided that it's not going to hurt me. I'm just going to do everything as though it's possible, and I'm still feel protected.
That is very smart, because you don't know, you may get the virus and not affect you, but you might become a carrier. That is the contention so far. We don't have any studies to prove otherwise yet. I know they are doing some studies, and probably very soon people who have had shots should not wear a mask. But there is a big movement in our country, unfortunately, where people were convinced that wearing a mask is bad for the health. That is a fallacy. Wearing a mask is not bad for your health. Surgeons and nurses in the hospital and operating room have been wearing masks all their lives, okay? For hours and hours, probably for 8 to 10 hours a day, and nothing bad has happened. So there's adequate information. If you're breathing well, you're putting enough oxygen in your body, you are not deprived. A lot of people have made these points that is bad for your lungs. And I want to send a message, a clear message. You don't wear a mask, you are a selfish citizen.
Yep.
You are doing a disservice to yourself and to your fellow citizens, because half the people out there will get COVID and have no symptoms. So you don't even know that you have the virus in your body, but you are spreading it out and causing damage to a lot of people and everybody you meet if you don't wear a mask. So the mask
right.
is, yes.
You're right. And I'll tell you a story that when the weather was cold and a lot of wind, I'm an asthmatic. I don't suffer from it very often, but I do have that tendency. And the mask helped me because the cold didn't go straight into my mouth or my nose.
Yes, just now, you read the story a month ago, I think, Gloria Estefan, everybody knows her, famous Miami musician. She was at a restaurant which she had avoided for months and months. But with her 2 children and her husband, they went to a restaurant and they were eating. And a fan came by. And she felt obligated to talk to her. And the fan did not have the mask on. Lo and behold, that fan gave her and her entire family COVID, and they suffered for a few weeks. So this is how easy it is to spread, because you don't know, I don't know, I have the virus and I could be spreading out just because I didn't wear a mask. So that's a good story to tell people that, look, even well-meaning people who have been avoiding social contact, they've been distancing themselves, but could just have one exposure to somebody who is carrying the virus, and lo and behold, you are sick. And especially your viewers are mainly in the senior category. They are very, very susceptible.
Yes. My son is an attorney and he has about 4 assistants, and one of them stupidly took her kids to Disney World. And she came back, she infected all the people in the office. And even though my son has been very careful, he got it, but he only suffered 1 day. And he's been quarantined at home for 14 days in his own bedroom. And they have 15-year-old triplets, and they have been going to school a few days a week. But everybody's been very cautious. So he now just passed the time that he's supposed to be quarantined. But just that one thing she did, it upset the whole office, it upset their business. It was terrible.
Yes. Our nation already has about 500,000 people dead, and thousands and probably a few million who have suffered. This could have been avoided, really avoided, if our nation from the very beginning,
right,
a strict policy of testing anybody who comes and testing everybody as much as possible and mandating the wearing of the mask. We had a president and an administration that was preaching against it, which is so
I know, it was
wrong.
terrible. Right, I agree.
Great disservice to us
Yeah.
all.
And we lost a lot of time and a lot of people. I do, you don't want to get me started on that because I think it was terrible, but thank goodness now I think people are realizing what I thought is instead of just giving numbers, they should have, and I know it's maybe because of the HIPAA, they should have gone into the hospitals and shown the people suffering on the ventilators, on with all the wonderful healthcare workers and what's going on. They didn't do that enough. If they did that, maybe they would make people realize it was no joke and it was something to take serious.
You're so right. I've seen posters that say mask or a ventilator. You choose.
Yep. Yeah, I know. Well, hopefully we're going to be okay now. I think there's a turn, but now we get the weather, and I feel so sorry for the people who are suffering with freezing cold from the north and the Midwest, and now they can't get their shots, and all sorts of things are happening. But you have to put one foot in front of the other and just do the best you can, right?
Yes, yes. Mother Nature is not complying, but you have to adapt. Absolutely.
Yeah. So tell me, let's get back to medicine a minute. Tell me, are there any new medical features or medical maybe antibiotics or things that people can now do, whether they have heart conditions or strokes, or is there anything new on the horizon that you can share from anywhere, from whatever you think?
Yeah, you are asking whether there are any preventive measures patients can take in terms
Yeah,
of
for anything, sure.
antibiotics don't work against virus, but they are antiviral agents and so on, and so many other new drugs, even some anti-worm medications. So many different medications have been proven to be perhaps helpful. A lot of studies are going on, but there are no medications that they are being advising you to take as a prophylactic. But you can strengthen your immune system. And how do you strengthen your immune system is by keeping yourself healthy. And how do you keep yourself healthy? Number one, get daily exercise. You can go out and take a walk, You can do exercise in your own house or your treadmill or bicycle or stationary bicycle, or go out at least, half an hour a day minimum, get some physical activity. Eat smart. A lot of us as Americans, we eat very unhealthy. So include more fruits and vegetables in your diet, because vegetables are your best friends that support and help your immune system stay strong. And then you can take some herbs and spices that help you, like, ginger, garlic, cumin, turmeric, and
I take elderberry.
sorry?
Elderberry.
Elderberry is a good source of vitamin C, and it does well. Vitamin C people are taking, but studies show that excessive amount is not necessary. Like
No,
you get
right.
your fruits and veggies, which give you a lot of vitamin C. And
The other thing that I do, excuse me for interrupting you, but I buy fresh beets and I cook them. So
okay,
I have beets to eat and I drink the beet juice.
okay, that helps. All you see, Mother Nature is such a great friend. Everything we need has been provided by Mother Nature for us. We don't have to take a pill, really, even for vitamins. If you have a wide variety of fruits and vegetables and wide spectrum of foods that are out there in your grocery store, if you ate them all, you would never need a vitamin. You would never need a supplement. And these, what you are saying, is above and beyond the extra. But if you really have a forage very well, so whenever you go to your grocery store, I advise all your viewers to be brave and try new fruits, new vegetables, new types of recipes, new cuisines, Chinese, Indian, and all of them add so many spices, especially Indian cuisine has a lot of spices, and you start adopting them because all these help. But don't stick to just a few veggies and a few fruits. Be a forager of wide variety.
That's a good point. That's right. We do tend to do what we like and we know, but that's right. Try something new. And now with the internet, you can read about it. You don't have to just eat the same thing and find out what you want. I just want everyone to know this is Dr. Mohsin Jaffer, the founder of the Senior Medical Associates. Here is their ad and you can see they have excellent doctors and they're located all over South Florida, mostly in Broward County. Their phone number is 954-659-9690. That's 659-9690, area code 954. If you call them, you'll get an appointment. Each one of their doctors are been trained by Dr. Jaffer. It's like getting him many times. But they are located Coconut Creek, Coral Springs, Deerfield Beach, Hollywood, Pembroke Pines, Plantation, Oakland Park, Sunrise, Tamarack, Weston. They speak many languages, so don't be afraid, but make sure you get your shot. It's been a little difficult. Some people are having a hard time finding them, but you can call. I think Publix is now doing it in some of the pharmacies, right?
Yes. All the hospital systems have them. And now
Yep.
there is a website by the state of Florida. So you can sign up on them and they'll show you where there is an opening and you sign up. You tell them just now they are open for 65 and above. They're available for doctors and their doctor staff. And also now they've opened up with people with pre-existing conditions, which make them more susceptible. So
Oh,
they're
that's
slowly
excellent.
opening up. We just had a problem with the supply chain. We didn't have enough vaccines come down. Even though America has them, they were not distributed in a very robust manner. Now, of course, it's all heating up, and I think I'm very optimistic now. The new administration is pushing for dissemination of the vaccine and also funding the states, which was not happening before, to pay for all this logistics. But there's a lot of logistics involved, especially with the Moderna and the Pfizer vaccine. They need refrigeration. Pfizer needs very special refrigeration. But very soon you'll have other vaccines from Oxford, AstraZeneca, which you can keep in ordinary fridge. And that'll be even make it easier. So that also should be approved soon. The Johnson & Johnson vaccine will be approved very soon, I'm sure. It doesn't require such stringent refrigeration requirements.
And you know, Dr. Jaffer, I always get my flu shot every year. I did get my flu shot. I also had an pneumonia shot, which you don't have to get every year, just I think once every 10. But I'm very, very good about doing that because scientists have spent a lot of time and effort and money to make these vaccinations. And I think when people say, oh, well, I don't need it, I look at them and of course you can't argue with people. Yeah, maybe you can because you carry a lot of weight, but I just have given up. I said, okay, well, that's what I do.
Anita, you make an excellent point about vaccination. You and me grew up in a time where there was polio rampant. You had classmates and friends who got polio. So many died. Millions of kids died. Millions of kids got crippled for life. Millions of kids got it, but now they're getting their resurgence of polio again now.
Yes.
So you see, it's coming back. Those who got it in childhood and it stayed in their nerves didn't affect them, but now it's affecting them. So it was a great scourge. And what eradicated it is American scientists who invented the vaccine. First it was Sabine and then Jonas Salk. They made the vaccine because Sabine was an injection and Salk made an oral vaccine. And we cured polio all around the world. We just eradicated polio from all over the world. Only 2 countries are left. Just now, just a few months ago, we certified Africa free. There are only 2 countries left because of logistics and cultural issues. But otherwise, we have eradicated. I belong to Rotary Club, which was pioneer. For 25 years, we pioneered this idea of Polio Plus, of giving polio vaccines all over the world. We already spent almost $1 billion. Today, we have the help from WHO and from the Bill Gates Foundation. They are matching our funds. So this effort is still continuing because if you stop vaccinating kids, they get it. A good example is what happened in America recently. A lot of people started having this idea that don't give mumps and don't give measles, and it's bad for your body. It's this, it's that, it causes this. There's a lot of false propaganda and they stopped giving. And we started having a resurgence of these diseases, which we had eradicated. So vaccination is a very important thing because we must understand and appreciate that the viruses are around us. Every time you take a deep breath, if you take a pound of soil, you got billions of viruses inside there. Plural is viri. So you got all these viri around you. You're taking them, inhaling them, eating them, with your food, everything. And some of them just become bad, like the Wuhan city virus, which we now will call SARS, COVID vaccine virus. Now it has no treatment, just like Ebola killed thousands of people in Africa, but we contained it. The Chinese didn't do a good job in letting us know. We could have contained it in China and perhaps only one district of China, and it would have never left. Would have never had this catastrophe where millions of people already died all over the world, and it's caused suffering and economic damage beyond understanding. This is how serious any one virus can mutate and become. So it is a scourge that will continue affecting mankind forever. It could even wipe us out. It almost wiped out 50 million people 100 years ago, the Spanish flu. 100 million people died. In America, 5 million. And it caused tremendous damage. So this have been going around for centuries, and we just have to be aware and appreciate that Mother Nature can sometimes not be our friend.
I had a personal experience. I don't want to run out of time, but I'll just share this. I lived in Minneapolis for a little bit, and I was a volunteer at one of the hospitals, and there was a young woman there who lived in an iron lung from the time she was 9, and I met her when she was 30. She could only move her head, but she learned to paint with a stick in her mouth and type and all, but that's how she lived. And so, I mean, in this iron lung, and people don't even know what an iron lung is. I guess it's close. A ventilator is a model, a model of an iron lung, but
yes,
I saw it, and I can't believe when people do that. But you know what? I think we have a lot of good things happening now. People are jumping up, and doctors like you keep professing all the good things, and that's why we're so happy to have you share all your feelings with our audience, Dr. Jaffer. You're really a king of hearts here, as a matter of fact. And remember, this is for you. I wish I knew how to get it to you. When you go to a bank and they have that chute that you put a cash something and it shoots it up to the bank. I wish I knew how I could shoot this to you in your. But I want to also tell you that your son, Muhammad, is really a wonderful young man. And I don't know if he has a family. I don't know much about him, but do you have more sons than that?
Yes, he's a bachelor. He's the youngest. I have a daughter who's married and she's pregnant. She should have a baby next month, hopefully.
Oh, wow.
Yes, that'll be my first grandchild. And then I have a first son who's married, but he doesn't have a child yet. And Mohammed is still a bachelor.
I see.
You praised me for what we do. I am among all these doctors all over our country who have given service selflessly because they truly wanted to get into a profession where they can make a difference in other people's lives. So all our doctors and nurses stepped up in this pandemic and have delivered care to the best of their abilities, many times at great risks to themselves. Yes. So I celebrate them, and we celebrate and salute them because they really stepped up to really help our fellow Americans. And without their sacrifice, many thousands more would have died. And we
You're absolutely right. And they work day and night, and you're right. And of course they are being celebrated. Thank goodness, wherever people are, they realize how important they are. And it has gotten to them also because they have had to hold the hand of many people who pass away, and the people they haven't seen their loved ones. It's, as you said so well, this has been a horrible situation, and now we have to do everything possible to get rid of it, do what we're supposed to, stay clean, and just keep a mask on. I don't go to restaurants, but I walk by them and I see that there are mobs of people in these restaurants without masks.
Unfortunately, yes. A lot of our fellow Americans don't believe that there should be. and they are eating. So it's also difficult to wear a mask while you are actively eating. So that's why if you can go to a restaurant, especially our seniors, please sit outside because the wind blowing around. Just remember that we cannot see the virus that are spewed out while we are talking or coughing or laughing. And these viri are in the air, they float for many hours. So if it's a closed environment, they are all in the environment, and you walk in and you take a big breath of them, you are infected. And
Right.
that can
Well, I don't know about you, but I'm not going to restaurants. I eat at home. And I don't. I just don't take a chance until this thing has really been curtailed and enough people have had the masks. I'm just happy staying at home, taking care of my dog, and working and doing what I can. And I guess I'm very conservative in that way, liberal in other ways, but conservative with my health. And because I live alone now, you know, my husband passed away, and so there's no one really here to help me, and so I have to help myself.
You're right. You know, you're doing what is right for you. On the other hand, the restaurant workers are really suffering. Restaurants are closing. People's livelihood has been taken away, and I don't know how they make ends meet. That's why these checks are very useful. But it is a good idea. Like we as a Rotary Club here in Weston, we started Rotary Feeds the Frontline, and we started going to all the restaurants and buying food from them to keep
Right.
them in business. And
Yeah.
supply food to the frontline people.
Sure,
Because the
and
hospital,
that's very nice of you. And then, or you can order food and have it sent home. I mean, I do understand what you're saying. Well, we're just about out of time. And as usual, I love having you come on, Doctor. I have to say this to you. Dr. Jaffer, you are rare. And I've talked to many, many doctors for many years, but you are, and I'll call you a rare bird. We're so happy to have you with us, and we'll talk to you again, and just keep doing all the wonderful things you do. And if you ever want to write an article, small little article or something for us, we'll put it in there for you. You've got
Okay.
anything that
My
gets you that
pleasure.
you'd like to do, we'll do that. Okay, so, and before I go, one more thing. I just heard about a man, 117, a woman, a nun, who's 117 years old. We're going to feature her in March on the cover.
Wow. Yes. That is a celebration. You're right.
That's a celebration. That's right.
Aging with vitality is such a great success.
I know it. So thank you, and goodbye, everybody. We appreciate you
helping all our viewers with that. God bless you.
Thank you. The same to you, Dr. Jaffer.
Thanks.